Hello and welcome to the WeTHRIVE Learning Collaborative webinar series. We are going to go ahead and get started right now, but first I would like to introduce two registered dental hygienists from the Cincinnati Health Department. Akino Kishigawa and then Janine Smith are both here to do a presentation in regards to oral health and the impact of your health. So with that, I would like to go ahead and introduce Akino and Janine, and I will go ahead and turn it over to them. Really quickly also, throughout the presentation, if you have any questions, please feel free to type it into the chat box and we will get your questions answered. So thank you so much, Akino and Janine, for being here today with us.
Thanks, Christy.
Thank you for having us.
All right. Okay, your mouth has answers for everything. Your mouth is also the gateway to optimal health. This means that total body health starts right in your mouth. Oh, there. This is a picture of James listening to oral hygiene instructions. This is probably what majority of people think when they listen to dental hygienists preaching about how often they should floss and brush and what to avoid, drinks and food. I don't blame you. Yes, it can be boring, but dental care is one of the most important aspects of your health. Now, this is Megan. This is what we want to see, the excitement. If everybody was as excited as Megan, we would be thriving. Let us begin this webinar with enthusiasm. So the question and the topic for today is, what does your mouth say about your health? Learn about yourself by exploring your mouth today. My name is Akino Kishigawa, and
my name is Janine Smith.
We're going to learn about oral disease and prevention. Today's overview, we're going to cover oral health, its complications, disease prevention, and we will review some tidbit of information about access to dental care. More than 1/2 of Ohio adults have had some teeth removed, while 1 out of 10 people have had all their teeth removed due to tooth decay or severe gum disease. But don't worry, dental complications are preventable. So what is oral health? It means the state of being free from oral pain, oral cancer, infection, gum disease, tooth decay, tooth loss, and other diseases and disorders that limit you from everyday well-being. Why am I discussing about teeth, tongue, saliva, blood, and germs? Because each one of these serves several purposes to your health. All of these can affect your mouth, your body, and your relationships with others. So let us begin with teeth. Did you know that teeth are the hardest bone in your body? They have glassy barrier called enamel, which protects teeth from bacteria, acids, and uncomfortable temperatures of daily usage from chewing, biting, and grinding. Your teeth talk and communicate with your brain whenever there's a change in temperature or when they're being assaulted by chemical, trauma, pressure, or germs. Teeth, along with other structures in your mouth, such as gums and bones, they tell you when to stop biting. Have you ever bit on something that wasn't supposed to be in your food and all of a sudden you stop biting because you bit on that something hard? Now, isn't that an amazing reflex? We really do take teeth for granted. All right, let's talk about other functions. Your teeth also give structures to your face and your smile. They give your lips a support and they help you speak and pronounce out words. Look at the difference in this photo. Teeth can change the way you look and the way you feel. Tongue, the fleshy muscular organ in the mouth that's used for tasting, licking, swallowing, and aids in speech. Did you know that your tongue can grow bigger, which can affect your sleep? Your tongue is also covered with taste buds and has thousands of hair-like structures, which is why we encourage you to brush your tongue to avoid getting bad breath and diseases. Our next slide will show more about secrets that your tongue can reveal. Here it is, the secrets your tongue reveals about your health. Tongue says a lot about your health. Bright red tongue is a sign of vitamin B12 deficiency, while white to yellowish coating on the tongue indicates possible yeast infection. Black hairy tongue could mean bacterial overgrowth. So, what does your tongue say about your health? The function of saliva include moistening food or lubricant and helping to create chewed food so that it can be swallowed comfortably. Saliva contains antibacterial properties that help fight cavities and enzymes to break down sugar. Saliva also acts as neutralizer in the presence of acid. In other words, they put out fires in your mouth. People who are unfortunate and suffer from dry mouth syndrome have tendency to accumulate more bacteria and are prone to cavities. It is recommended to drink lots of water to keep your mouth moistened. Take-home lesson: embrace your saliva. Blood is helpful in transporting oxygen from the air that you breathe, nutrients, waste products, hormones, as well as heat. It helps protect and fight infection, and it also helps with blood clotting. Blood regulates your body's temperature and keeps chemistry of your body balanced. More importantly, blood is an indicator or a sign in the mouth that tells us if something is not right. Now, when you see blood while you're brushing or flossing, that means you may have gum disease. My best advice for you is to grab that toothbrush and floss and get rid of those germs. Germs. Germs are everywhere. We have different types of germs in our mouth, such as bacteria, virus, and yeast. There are bacteria which will destroy teeth versus bacteria that cause gum disease. We have viruses that cause mouth sores or oral herpes lesions. We also have yeast-like fungal infection that can grow in your mouth and underneath your dentures, partials, or flippers. Let's go over different types of bacteria. What we have is a picture of cavities. Cavities are holes formed in teeth. Cavity-forming bacteria are biofilm, plaque biofilm. Plaque biofilm is basically a clump of germs and is sticky, white, creamy material that grow on your teeth daily. If you fail to remove this plaque, they will literally eat away layers of your teeth and give you cavities. People have different types of bacteria in their mouth. The bacteria that live underneath gum tissue, The bacteria that live underneath gum tissue will destroy the structure of your gums and bones. When gum disease develops, bad odor, bleeding, swelling, pain, and tooth mobility will be evident. Talk to your dentist or dental hygienist if you experience these symptoms. Viral infections such as fever blisters or cold sores are herpes simplex virus. They can sneak up on you when you least expect it, especially if you're under a lot of stress. They can spread easily, so avoid sharing eating utensils, drinking out of the same cup, and sharing chopsticks with your friends. Oral warts are human papillomaviruses, or HPV. They can appear anywhere within the mouth, on the lips, and are generally not painful unless they have been irritated or traumatized. Remember this, HPV can turn into cancer. So how does yeast infection form in the mouth? When balance is disrupted in the mouth, harmful bacteria and fungi begin to multiply. This causes oral thrush to develop. Oral thrush can also occur when your immune system is weakened by medications, which will reduce the number of good bacteria in your mouth. Please see your dentist if you suspect yeast infection or oral thrush. Our next agenda covers the complications of poor oral health. Such complications include gingivitis, periodontal disease or pyorrhea, it's also called bone disease, dry mouth, decay or cavities, tooth loss, oral cancer, and diabetes, to name a few. Let's start with gingivitis or swollen gum. Gingivitis is the first stage of periodontal disease or bone disease. Symptoms include bleeding, red and swollen gums, bad breath, and gums pulling away from teeth. Gum disease can occur more frequently than you think. Leaving plaque, fluid, or debris by your gum will easily irritate your gums and give you gingivitis. The risk factors for gum disease include lack of oral hygiene care, smoking or chewing tobacco, diabetes, dry mouth, certain medication, crooked teeth, pregnancy, ill-fitting plates and fillings, medically weakened immune system, and so forth. Center for Disease Control and Prevention indicates that over 70% of Americans have bone disease. Systemic disease that interfere with body's inflammatory system may worsen the condition of the gums. This just means that disease and inflammation should not be prolonged together for a long time. The key word here is inflammation. Inflammation is body's response to healing. Increase in inflammation and constant state of inflammation will trigger your body to damage other parts of your body. One good example of systemic disease is diabetes. Diabetes can interfere with oral health. People with diabetes are more likely to develop severe gum disease. There are other factors that are involved in destroying gums. Studies have shown that tobacco use may be one of the most significant risk factors in development and progression of bone disease. Also, some drugs, such as oral contraceptives, antidepressants, and certain heart medicines can dry your mouth and affect your oral health. Remember, dry mouth increases bacterial load, which will affect your oral health. Poor nutrition can also compromise the body's immune system and make it harder for the body to fight off infection. According to American Academy of Periodontology, half of American adults suffer from gum disease. That's about 64 million people. Dry mouth or xerostomia is often a side effect of certain medications or as a result of radiation therapy for cancer or even from head and neck surgery. Age is also a factor that causes dry mouth. As we get older, our mouth gets drier. Symptoms of dry mouth are dryness, bad breath, difficulty chewing, swallowing or speaking, cracked tongue, and difficulty wearing dentures. Decreased saliva and having dry mouth can impact your general health and the health of your teeth and gums, as well as your appetite and enjoyment of food. When tongue appears cracked, it is indicative of dry mouth from lack of moisture, saliva, or side effect of medication. Keep your mouth wet can save you from oral complications. According to National Institute of Health, about 91% of adults have had cavities. 26% of adults have untreated decay. How are cavities formed? Cavities are formed by a combination of different dynamics that take place in your mouth. Think of science experiment gone wrong. When a perfect environmental condition in the mouth is disrupted, chemical imbalance, along with accumulation of bacteria and surreal load of sugar, can destroy your teeth. Tooth loss. About 27% of seniors have no remaining teeth. This can make a huge dent to anyone's finances. A set of complete dentures, which is upper and lower dentures, can cost on the average of $1,300 according to Healthcare Blue Book. Oral cancer as a complication is the sixth most common cancer in the world. 8,000 Americans die of oral cancer each year. Most common risk factors to oral cancer include exposure to tobacco use and alcohol consumption. The most common site for oral cancer is the tongue, right on the side border of the tongue or the floor of the mouth. It's often not noticed because the scabs that form do not hurt. And since they don't hurt, people don't think anything of them. Diabetes. There is a rising number of diabetes cases according to U.S. Center of Disease Control and Prevention. 1 out of 4 Americans do not realize they have the disease. That's 25% of Americans. They don't realize they have diabetes disease. 1 in 3 Americans have prediabetes. Medical News report states that type 1 and type 2 diabetes are rising among our children and adolescents in America. We will expect that number to rise since our diet and lifestyle are changing. There's approximately little over 30 million people nationwide who are living with diabetes disease. Let's talk about diabetes disease in Ohio. In Ohio, there are over 850,000 people over the age of 18 who are diagnosed with diabetes. Now let's look at Hamilton County, specifically in the greater Cincinnati area. There's about a third of population with diabetes. That's 300,000 people in Cincinnati who suffers from this diabetes disease. Diabetes remains the 7th leading cause of death in the United States. So what is diabetes? Diabetes is a condition in which the body does not properly process sugar for use as energy. So in other words, your body is not able to use its own fuel, which is sugar, to move and function the way normal people live. The body either does not make enough hormones called insulin to break down sugar, or it cannot use its own insulin as well as it should. This leaves sugar to build up in your blood. This debilitating disease can cause serious complications to your health. These complications include the following: heart disease, nerve damage, kidney problem, eye damage, oral disease, and many more, but we will just discuss these few complications. Diabetes dramatically increases the risk of various heart problems, include chest pain, heart attack, stroke, and narrowing of arteries called atherosclerosis. Heart disease is the leading cause of death for both men and women. In 2017, heart disease claimed 801,000 lives in the United States. That is 1 out of 3 people dies from heart disease. Nerve damage is a common complication of diabetes. Nerve damage or diabetic neuropathies are nerve disorders caused by diabetes. Symptoms of nerve damage include pain, tingling or numbness in hands, fingers, arms, feet, and legs. This can also result in amputation of extremities of your legs. Another complication of diabetes is kidney problem. Approximately 1 in 3 adults with diabetes and 1 in 5 adults with high blood pressure may have kidney disease. Diabetes can cause damages to your eyes. It can cause blindness. Approximately 1 in 3 adults with diabetes have signs of eye disease. Having blood sugar level that stays high over a long period of time can damage the tiniest blood vessels in the back of your eyes and cause swelling or inflammation. There's that word again, inflammation. This swelling can cause you to have blindness, blurred visions, glaucoma, and cloudy lenses called cataract disease. Anyone with diabetes can develop eye disease, but having high blood sugar level, cholesterol, high blood pressure, along with being a smoker, can put you in higher risk for diabetes-induced eye disease. A recent study in the Journal of American Dental Association found that 1 in 5 cases of total tooth loss in the United States can be linked to diabetes. Periodontal disease have been proposed as the 6th common complication of diabetes. People with diabetes are more likely to get severe gum disease. Severe gum disease is an infection and it is chronic in nature. That means that a disease will stay with you a lifetime. There is no cure to severe gum disease, and that has begun to destroy your jawbone. If infection continues without proper care, one can compromise losing several teeth. The good news is this disease can be maintained if you take control of your health. Diabetes is linked to oral disease. This chart displays a relationship between diabetes disease, gum disease, and inflammation. Having uncontrolled diabetes or a high sugar level means more plaque. Heavy plaque creates unfavorable environment in the mouth, which causes gum disease. Where there is gum disease, there's inflammation. This ongoing inflammation or swelling is linked to resistance to insulin. And as you remember, insulin is a hormone that removes sugar from the blood. When body is unable to break down sugar, your sugar level will rise. So you can get complications of diabetes as this cycle repeats itself. Let's briefly cover some helpful information that could be helpful to you in the future. There are resources. Insurance. If you are employed, check with your employer to see if they offer medical and dental insurance. Take advantage of employees' benefits. Medicaid versus Medicare. See if you can get better dental benefits through your health insurance. Know what you're signing up for. What's the difference between Medicare and Medicaid? Some Medicaid only covers cleaning and not for dentures and partials, and some do. Medicare does not offer dental benefits. It's easier to remember it this way. Medicaid will aid, while Medicare does not care when it comes to teeth. State program. Check out your state for safety net programs that offer medical and dental services. School dental program. Take advantage of school-based dental program. If you have a child that goes to CPS or Cincinnati Public School, sign them up for a dental prevention program. They have awesome dentists. You can also get your teeth fixed at any dental school near you for a nominal fee. Free dental clinics. Some cities provide free dental clinics. Get in touch with charitable organizations and find out if they offer free medical and dental services. VA Dental. If you're an injured veteran, seek dental care through VA Dental program. They have the state-of-the-art facilities, and they are there for you. Online coupons can be tricky, but one can definitely get discounts through them. They often have bleaching discount, which can save you a lot of money. And last but not least, if you're a traveler, check out the dental tourism. Sometimes it's more affordable to fix your teeth while you're traveling internationally. Up next, Ms. Smith will be discussing about prevention of oral health complications.
Okay, so let's talk about prevention. Prevention is better than cure. As we know, the health of our body mirrors the health of our mouth. If our oral health is bad, then chances are our physical health will be affected. But if our oral health is good, chances are our overall health will be good. As we have learned in previous slides, the connection between oral health and overall health is substantial. Good oral health can prevent heart disease, stroke, diabetes, dementia, premature birth, and can even reduce respiratory issues. Your dental health reveals how you feel about yourself. If you're self-conscious about your smile, then it is going to affect how you interact with others. Our teeth can influence how we speak, how we eat, chew, taste, socialize, and enjoy life. It can encourage a positive state of mind. Great smile equals great confidence. However, there are some groups that need to take extra precaution as far as their oral health. For example, children, pregnant patients, women, those in nursing homes and or assisted care facilities, and also those with HIV or AIDS. So let's talk about children first. As soon as the first tooth comes in the oral cavity, parents should begin to brush their child's teeth. Parents should focus on taking care of their child's oral needs from an early start, which can set the stage for the child's oral health later on in life. Parents may have to use playful motivational techniques to encourage their children to brush from 3 years old and onward. Children will not be able to get the toothbrush technique until they're around the age of 6. And so parents, even at that point, still may have to rebrush with their child after they have brushed. Parents should lead and supervise their children's toothbrushing approximately for the first 12 years until motor and mental functions allow the child to routinely perform a proper toothbrushing technique alone. Interestingly, studies show that only 37% of parents brush their child's first tooth. and the other 63% waited for multiple or a full set of teeth. So the lesson, it's best to start good oral health habits as soon as possible. So parents, in order to instill good toothbrushing techniques in their children, have to make it fun. But whatever you do, get creative and switch things up so brushing time is always a good time. So a good technique would be a 2-minute brushing song. That can make brushing fun. We could even purchase colored toothbrushes or an electric toothbrush. Use a timer or hourglass. Videos or brushing apps may also make that time fly by. Start a routine and stick to it. Reward good brushing behavior. Make up a story. Did you know 51 million school hours are missed due to oral disease? Children who have reported having recent tooth pain were 4 times more likely to have a low grade point average, below the median GPA of 2.8, when compared to children without oral pain, according to study results. Dental decay is not only preventable, but it saves money. Another group that we need to focus on is women. There are some stages in life where women are more susceptible to gum disease. Puberty. The increased production of female hormones such as estrogen and progesterone can increase the blood flow to the gums and change the way the gum tissue reacts to the bacteria. This causes tissue to become red, swollen, tender, and more likely to bleed during brushing and flossing. The menstrual cycle. Due to the increased progesterone levels during menstruation, many women tend to have red, swollen, bleeding gums. Menstrual gingivitis usually begins 1 to 2 days before the beginning of the cycle and usually clears up after the period has started. Menopause. Many oral changes can come about due to advancing age, additional medications, and also hormonal changes. Certain medications can dry mouth, which can lead to periodontal disease because saliva is not available to neutralize the acids produced by the plaque. Changes in females' hormones can lead to increased risk of canker sores, dry mouth, changes in taste, and gum disease. Pregnant women also have very special oral hygiene care needs. It's recommended that pregnant women have a complete oral exam in the early stages of pregnancy. Many pregnant women avoid dental treatment during pregnancy even if they have dental pain because they feel that treatment will harm the baby. However, according to the American Dental Association, as of 2015, studies have shown that dental treatment with anesthetics during pregnancy is safe and is not associated with increased medical problems in newborns. Practice good oral hygiene to prevent dental disease, such as pregnancy gingivitis. Pregnant women may have changes in taste. Both poor oral hygiene and higher hormone levels can lead to pregnancy gingivitis, which, again, causes the gums to be inflamed, red, and tender. Another group are those who are in nursing homes or assisted care facilities. Daily oral hygiene assistance from the nursing staff in these facilities is vital. Oral hygiene tools need to be implemented in these environments to reduce gum disease and tooth loss. Daily oral hygiene is often neglected in long-term care facilities. Research suggests that nearly 80% of long-term care facility residents need help with daily oral hygiene care. Some of the things that affect those who are in nursing homes or assisted care facilities is untreated tooth decay. Nearly all adults, 96%, aged 65 years or older, have had a cavity. 1 in 5 have untreated tooth decay. 2, gum disease. A high percentage of older adults have gum disease, and about 2 in 3 adults aged 65 years or older have gum disease. Also, tooth loss. Nearly 1 in 5 of adults aged 65 or older have lost all of their teeth. Complete tooth loss is twice as prevalent among adults aged 75 and older compared with adults aged 65 to 74. Having missing teeth or wearing dentures can affect nutrition because people without teeth or with dentures are often prefer soft, easily chewed foods instead of foods such as fresh fruits and vegetables. Oral cancer. Cancers of the mouth are primarily diagnosed in older adults. Median age at diagnosis is 62 years. Chronic disease. Most older Americans take both prescription and over-the-counter drugs. Many of these medications can cause dry mouth. Reduced saliva flow increases the risk of cavities. If you or someone you know is living with HIV or AIDS, the ADA, or American Dental Association, recommends that dental care be part of the HIV/AIDS treatment. People with human immunodeficiency virus, the virus that causes acquired immunodeficiency syndrome, are at special risk for oral health problems. Many of these problems arise because the person's immune system is weakened and less able to fight off infection. Your mouth may be the first part of your body affected by HIV or AIDS because infection with HIV will weaken your immune system. So this means you'll be more susceptible to infections and other problems. In your mouth, this can cause pain and tooth loss. Many HIV patients face the following mouth issues. Oral candidiasis, also known as thrush. It produces white sores in your tongue and roofs of your mouth, but it can be cured with antifungal medications. Kaposi sarcoma is the most common AIDS-related cancer. Perileukoplegia is the most common HIV-related manifestation. It is an oral infection caused by the Epstein-Barr virus. It appears as a white corrugated lesion, sometimes hairy in appearance, and it's primarily found on the lateral aspects of the tongue. Dry mouth. Due to salivary decrease, allergies and infections may cause dry mouth, and certain medications can do that. Periodontal disease is marked by a profound red banding along the teeth where the gums and teeth meet. LGE is related to and may be a precursor of other diseases such as NUP, or necrotizing ulcerative periodontitis. NUP is a condition that causes pain, spontaneous bleeding of the gums, and a rapid destruction of gum, tissue, and bone, which may lead to tooth loss. People often describe their discomfort as deep jaw pain. Necrotizing ulcerative periodontitis and linear gingival epithelium are best treated with a thorough dental cleaning and chlorhexidine rinse. Dentists may also prescribe antibiotics. Early detection and treatment is very important. People with HIV or AIDS develop gum disease more easily than those with healthy immune systems. Therefore, they are encouraged to visit their dentist regularly for scheduled appointments, brush and floss their teeth twice daily for 2 minutes, take their medications as scheduled, tell their doctor if their HIV medicine is causing dry mouth, and if you don't have a regular dentist, ask your primary care provider or clinic for a referral. So let's talk about some tips for good oral hygiene. Brush at least twice a day with fluoride toothpaste for at least 2 minutes, especially first thing in the morning and before bedtime. Floss every day. Limit the number of times you eat snacks each day. Visit your dentist every 6 months for an oral exam and professional cleaning. As we know, the recommended brushing time is 2 minutes twice a day, morning and at night. So that turns out to be 4 minutes a day, 28 minutes a week, 120 minutes a month, 1,440 minutes a year, 79 days in a lifetime. However, not just children, but the average person is not brushing according to the recommendations. According to the Academy of General Dentistry, the average person only brushes 45 to 70 seconds per day. So if you don't floss, which is one of the aspects that a lot of people miss, you miss about 40% of your tooth structure. Studies mention that 73% of Americans would rather go grocery shopping than floss. The average American will use 14 inches of dental floss every year. However, dentists recommend using 18 inches of floss per flossing session. Most floss containers have over 40 yards of floss. So let's talk about some common mistakes as far as our oral hygiene routine. 1, picking the wrong toothbrush. Soft bristles are very important because they can bend and reach beneath the gum line, and choosing the right size brush head is very important depending on the size of your mouth. Another mistake is brushing way too hard. Most people think that they have to brush vigorously to achieve clean teeth, but we have to remember that plaque is loose and soft, so scrubbing is not necessary. Actually, vigorous brushing can wear away the gums, causing root exposure, which is irreversible. So while brushing, instead of thinking of the word scrub, think of the word massage. Another common mistake is brushing back and forth. Brushing this way can do more harm to your gums than benefit. Again, we have to think massage and not scrub. So up and down circular motions is the most effective way to brush. Another mistake is forgetting the gum line. Being in dentistry, the most common area that we see being missed is the gum line. Bacteria mostly hang out at this area. That is where gum disease starts, and then if it's not addressed, it spreads into the bone. Therefore, the gum line is the most important area you are to brush in the mouth. Oh yes, and let's not forget about the tongue side. Most people brush the outside and the chewing surfaces of their teeth. But think about this. If someone just washed one side of their hand, would you say they have effectively washed? Absolutely not. So that applies the same way to flossing. Our toothbrush cannot reach in between the teeth. So floss is so important because it's going to disrupt the bacteria in the teeth, in between the teeth, which can reduce cavities that form. Remember, the more you disrupt the bacteria in the mouth, the less productive and less dangerous this bacteria will be. Therefore, to prevent the accumulation of plaque, which leads to calculus and inflammation, we have to brush all surfaces of the teeth and floss. Another common mistake is not changing out the toothbrush frequently. It is recommended that we change our toothbrush every 3 to 4 months. Usually when we begin to see the bristles of our toothbrush flare out, that shows it's time to replace it. Another mistake is brushing way too soon. After mealtime, it is really tempting to want to go in immediately and brush all the debris off our teeth. However, after we eat, the natural bacteria in our mouth produces acid, and if we brush right away, we are spreading the acid around the teeth, which can potentially lead to tooth erosion. Therefore, after you eat, wait 15 to 20 minutes to brush to allow the saliva in the mouth to do its work, first on the acid, or you could even swish around with the water to remove the acid from your teeth. You don't have to floss all of your teeth, just the ones you want to keep. So let's talk about the process of tooth decay. Akino went into this process a little bit earlier, but everyone in their mouth has bacteria. However, when we combine the bacteria with a high sugar carb diet, the acid is produced. And then when the acid comes into contact regularly with the tooth structure, it wears down the outer structure of the tooth, called the enamel, and then it eventually leads to a cavity formation. Some interesting studies show that about 1 of 5 children aged 5 to 11 years have at least one untreated decayed tooth. 1 of 7 adolescents aged 12 to 19 years have at least one untreated decayed tooth. The percentage of children and adolescents aged 5 to 19 years with untreated tooth decay is twice as high for those from low-income families compared with children from higher-income families. So to stay healthy, eat lots of fruit, exercise, and brush your teeth twice a day. Diet and nutrition. Avoid regular consumption of sugar-filled drinks, juices, and non-nutritious snacks. Choose foods that are low in added sugar. Choose snacks such as cheese, fruit, nuts, and also raw vegetables. Disease progresses faster in people with nutrient-poor diets. Remember, foods eaten as a part of a meal causes less harm because the saliva release helps wash foods from the mouth and lessen the effects of acids. Nowadays, eating healthy is not cheap. Organic fruits and veggies can be very expensive, but there are some practical ways to eat healthy while staying in our budget. For example, eat meat only 2 or 3 times a week. Buy food in its natural state and give yourself time to cook it. Buy frozen fruits and vegetables. Eat packaged and extra processed foods. Eating packaged and extra processed foods costs more, so buy food in season and in bulk. Plan your shopping and meals. Make a list before you shop. Cook large portions and use your leftovers. Stop buying junk food. And if you do eat out, try to just order water. Consider early bird specials, share your meals, or consider 2-for-1 deals. This chart gives a wonderful example of how much you can save eating a healthy diet versus a less healthy diet. A less healthy diet consisting of no fruits or vegetables and more meat was more expensive than a healthy diet containing the daily requirements of fruits and vegetables and less meat. Fitness. The people who regularly worked out and have never smoked were 54% less likely to have periodontitis compared to those who reported no regular physical activity. A National Health and Nutrition Examination survey also found that even partially active people were 33% less likely to have periodontitis than those who did not exercise. Correlation between BMI and oral health. Health issues associated with obesity, such as hypertension and diabetes, lead to poor health. According to the study, individuals who maintain normal weight, engaged in the recommended level of exercise, and had a high-quality diet were 40% less likely to have periodontitis compared to individuals who maintain none of these health-enhancing behaviors. So, to establish a good routine of exercise, grab a friend, join a group class or a fitness facility. Take the steps instead of the elevator at work. Take a 15-minute walk. Every time you go to the bathroom, do 25 squats. Download an app or wear a fitness tracker. Consistency is important if you want to see results. It is the first step in maintaining an exercise routine. No exercise program will work if you do not do it consistently. American Council on Exercise recently surveyed 1,000 ACE-certified personal trainers about the best techniques to get fit. Their top 3 suggestions: set realistic goals, follow an exercise routine, and be patient. Remember that even if you follow all these tips, there will be ups and downs, setbacks and victories. Just be patient and don't give up, and you'll see solid results. Here are some examples of interval and strength training workout plans. Interval workouts burn more calories, improve aerobic activity, decreases boredom, and you can even do them at home. HIIT, or high-intensity interval training, is more effective than long periods of moderate-paced cardio. Wait until we get our slides pulled back up. So high-intensity workouts are more effective than long periods of moderate-paced cardio, such as running, cycling, and swimming. Studies have found that just 1 minute total of high-intensity interval training performed 3 days a week for 6 weeks was enough to significantly improve blood sugar scores and aerobic capacity. Also, no one should shy away from strength training. Strength training burns more calories, increases lean muscle, and reduces body fat. There are also some cautions, some things we want to be aware of as we're working out and we're starting new diets. Electrolyte replacement is necessary, but avoid sugary sports drinks. Athletes show more signs of enamel tooth erosion because of these sugary sports drinks. The more hours an athlete trains, studies show the more likely they are to develop a cavity. So how do we prevent this? Well, bottled water or even tap water is a great drink to keep yourself hydrated during physical activities. If you want to make it even healthier, you can add a splash of lemon or a pinch of unprocessed salt to get more minerals. Add a little flavor and replenish electrolytes. Coconut water. Natural coconut water with no additives is an extremely healthy choice. Not only is it very hydrating, it also has anti-inflammatory properties and helps balance glucose and insulin levels.
So, in summary, it's necessary to understand the importance of healthy mouth. Understand what your mouth is telling you. Take control of your health by taking care of your teeth. Changes begin in your mouth. It's the gateway to overall well-being. Take healthy food, drink lots of water, and burn those sugar by exercising. Make your annual appointment to see your dentist. And at home, make the brushing routine fun for your kids. Make memories that will be passed on to the next generation, and beyond that, remember, an ounce of prevention is worth a pound of cure. Thank you. Do you have any questions for us? Now, this concludes our webinar for today. I would like to thank Hamilton County for having us here today to discuss about oral health.
We thank you for your attention, and we appreciate that. We hope that you were able to pick up some good tips as far as how you can make sure your oral health reflects the health of your body.
Thank you so much for joining us on today's WeTHRIVE Learning Collaborative webinar. As always, please feel free to reach out to us with any questions that you may have following this webinar. And once again, I want to thank Akino and Janine for both participating in the presentation, and also for Cincinnati Health Department for allowing this presentation to happen. So thanks again, and I hope you have a great day.